Welcome to the bone video. We're going to be doing the axial bones today. It consists of the skull, the mandible, the vertebrae, the sternum, and the ribs. So starting with the skull, we have here on top the frontal bone, parietal, temporal, and occipital bones. Okay? You have sutures all around them as well, separating them. The suture separating the frontal and parietal bones is called the coronoid suture. Okay? Suture separating the parietal and temporal bone is the squamous suture. Both parietal bones is the sagittal suture, and occipital from the parietal bones is the lambdoid suture. Okay? Taking the mandible out, which we'll get to later, we're going to open the top of the skull where you can see your cranial vault. Okay, that's inside there. You can see the anterior, middle, and posterior fossas, these big portions, and the underview of the skull. So we're going to start here today. Right here, your external occipital protuberance. Okay, that big bump is the external occipital protuberance. Go on to right here, the occipital condyles. Those articulated with the superior articular facets of C1, the atlas. If you can see here, it's a little difficult to see, but right there, that is the hypoglossal canal. Okay, from this view as well. It's one of the few canals that are in the skull. It's both on this side and on this side. Okay, right inside that big hole, which is the foramen magnum. You can see it from the inside and a little bit from the side as well. Okay, so moving on from there, you have the mastoid process. Okay, this bigger one, the one that has a lot of mass, is the mastoid. This little thin one has a lot of style because he's nice and thin. That's the styloid process. Okay, so you have the styloid, mastoid processes, and then in the middle you have the stylomastoid foramen. Okay, stylomastoid foramen right in the middle of both of them. Right here, you can see it on both sides, you have the jugular foramen. Okay, that's the jugular foramen right there, and you can see it on this side as well. That's the jugular foramen. Okay, it looks like a J, so that's a good starting point, the jugular foramen. Right from a posterior view, from an inferior view, right on top of the jugular foramen is the carotid canal. Okay, it's not going to be easily seen from a superior view. That should be it right there, but it's more so known right there. Carotid canal right on top of the jugular foramen. Okay, right next to the carotid canals, this fossa is where the mandible goes, is where your jaw goes. Mandibular fossa. Okay, so that's that right there. Next you have this. This is the this is the foramen ovale. Okay, it looks like an oval, so that's the foramen ovale. Okay, the one medial to that, foramen lacerum or lacerum. Okay, so foramen lacerum, foramen ovale, and then this tiny one right there, foramen spinosum. Okay, foramen spinosum, ovale, lacerum. Okay, here you have the ear, which is the external occipital protuberance. That is the external acoustic meatus. External occipital protuberance is right there. External acoustic meatus. Inside, from the superior view, you have the internal acoustic meatus. You can see that here and here. That is not the carotid canal. Okay? Do not get that confused. Carotid canal is from an inferior view, right on top of the jugular. Not here. That's the internal acoustic meatus. Okay? Now, going on here. These right here. This is the medial and lateral pterygoid processes. Medial and lateral pterygoid processes. These are part of the sphenoid bone. Okay, so they go up all the way to the sphenoid bone as well. Right here, this whole thing is the hard palate. You have, this is part of the maxilla with the incisive fossa and foramen right there. And this is the palatine bone with the palatine foramen right there. Okay? So, just a quick recap. We have the external occipital protuberance, occipital condyles, the hypoglossal canal, which is somewhat inside the foramen magnum. Then you have the jugular foramen right there. Next is the carotid canal from an inferior point of view, mastoid process, styloid process, stylomastoid foramen, mandibular fossa, that's where the mandible articulates, the foramen lacerum, foramen ovale, foramen spinosum, medial lateral pterygoid processes, the hard palate with the maxilla being the majority of it, incisive fossa and incisive foramen, palatine bone, which is the bottom portion of it, with the palatine fossa and palatine foramen right there. Okay? Alrighty, now we're going to get to the superior portion of it. You have here, again, foramen magnum, the biggest foramen in the skull. Inside, as we showed earlier, the hypoglossal canal. Okay? Foramen magnum, hypoglossal canal. This right here, again, is the jugular foramen. Right there. Jugular foramen. Right there is the internal acoustic meatus, as we mentioned. This sella turcica, okay, that's important. That's where the pituitary gland sits. Okay, pituitary gland of the brain. That you need to know as well. Going back to these three, if you remember right here, we had medial was lacerum, ovale, and then spinosum. And it's going to be the same thing here. You have in the middle foramen lacerum, foramen ovale, and then that tiny one, foramen spinosum. Okay, so lacerum, ovale, spinosum. All right, right next to the sella turcica. Now, you have the lesser wings and the greater wings of the sphenoid bone. Okay? Right here, that's your optic canal. Okay? That's one of the other couple of canals that you have in the skull. This one right here, a little bit difficult to see. The foramen inside there, that's foramen rotundum. Not this fissure. Okay? That's foramen rotundum, right there. That is the supraorbital fissure. Okay? I'm sorry, superior orbital fissure. So, foramen rotundum, superior orbital fissure. Next we have the ethmoid bone, right here. That's the ethmoid bone, goes down up to the nasal conchas. Crista galli would be in the middle. Cribriform plate would be around it, with the olfactory foramina, which are a bit difficult to see in this model, but you can see it in the pictures from your manual or your textbook. So that's that. That's the ethmoid bone from this view. Again, crista galli, cribriform plate is around, olfactory foramina. So, again, to recap, we have foramen magnum, the hypoglossal canal, which is right there, external acoustic meatus, jugular foramen, foramen lacerum, foramen ovale, again, lacerum, ovale, spinosum, foramen spinosum, sella turcica, lesser, greater wings of the sphenoid bone, optic canal is right there, and is right there, okay, foramen rotundum, it's an important one, and the superior orbital fissures, okay? That's all for this view. Now let's get to the side. This, as we mentioned earlier, temporal bone, okay? That's the temporal bone. This right in front is the zygomatic bone, okay? So, this is going to be a bit tricky. There's a little suture right there that divides them. This process right here is the zygomatic process of the temporal bone. This process is the temporal process of the zygomatic bone. So the processes switch: temporal bone, zygomatic process, zygomatic bone, temporal process. This whole thing is called the zygomatic arch. Okay, so don't get those confused. Temporal bone, zygomatic process, zygomatic bone, temporal process. Okay? Now, going to the front, we have glabella right here, the third eye right in the middle. That's the glabella. Nasal bone right there, simple as your nose. You have, let's start with these. Supraorbital notch or supraorbital foramen. This one is a notch because it's an open hole. In your books it could be a foramen, so you need to know which one's which. Right here, supraorbital ridge or supraorbital margin, same thing. Right here, infraorbital foramen. So supraorbital foramen or notch, supraorbital ridge or margin, infraorbital foramen. And again, right here you have the superior orbital fissure inside the eyeball, inside the eye socket, and the inferior orbital fissure. Okay? So remember, fissure is just a slash. Those are the only two that you're going to see here. Okay? That's that. Here, this foramen, you have the lacrimal bone going all around. Lacrimal fossa is right there, and then the lacrimal foramen is the actual hole. Okay? That's all the tear ducts. All right? So that's for crying. Lacrimal bone, fossa, foramen. Going back here, again, nasal bone, you have the vomer. The vomer is seen right here, and if we turn it back over, is seen right here as well. Okay? So vomer is on both sides. Now, right on top of the vomer, from this angle, is the perpendicular plate, right there. Okay? That's the perpendicular plate. Now, these 1, 2, 3, 4. You have inferior, middle, and what we cannot see somewhere over there, superior nasal concha. The middle one is the one on top, inside the nose. Okay? Inside this nasal cavity. The top one is the middle nasal concha. The bottom one is the inferior nasal concha. Middle and superior nasal concha are part of the ethmoid bone. Okay? Superior nasal concha is somewhere around here, so we cannot see it. So don't get that confused. That's not inferior and superior. It's inferior, middle, and then there's a superior on top of that. Okay? So that's that. Here you have the maxilla, alveolar margin. Okay? That's for the most part it for the skull. We'll go over everything again very quickly in the front and in the side actually. Again, temporal bone, external acoustic meatus. You have that zygomatic process of the temporal bone, temporal process of the zygomatic bone, that zygomatic arch, which is the whole thing. Glabella, nasal bone, supraorbital notch or foramen, supraorbital margin or ridge, infraorbital foramen, superior orbital fissures, which is inside, and inferior orbital fissures, which again is inside. Okay? So that's it for the skull. Now, let's get to the mandible. So, mandible, your jaw. Your chin is the mentalis, okay, the mental. So that's right there. Then you have the mental foramen. Okay, mental foramen right there. And then going back here very quickly, you have the mandibular foramen in the back. So right next to your chin, right next to your mental, you have the mental foramen and then the mandibular foramen. Okay? Here you have the body. Okay? Again, the alveolar margin. Here you have the ramus of the mandible. Mandibular condyles. Again, mandibular condyles of the mandible articulate with the mandibular fossa of the skull. So that's how it would go. Okay? Mandibular fossa with the mandibular condyles. Now, we did ramus of the mandible angle, and then the conoid process, coracoid process. Okay, so ramus, angle, and coracoid process. Alrighty, that's the mandible. Again, we have mental foramina, the chin, which is the mental. We have mandibular foramina, mandibular condyles, coracoid process. We have the mandibular angle, mandibular ramus, mandibular body. Okay? So that's it for the mandible and the skull. Next we're going to do, very quickly, the sternum. Okay? Sternum is where it has cartilage connecting to the ribs. Alright, we're going to go over the ribs next. You have the 3 parts of the sternum. The very first one, right here, the manubrium. You have the jugular notch, right here, clavicular notch. And then very important, dividing the body and the manubrium is the sternal angle, right there. Okay? Jugular notch, clavicular notch, manubrium is the whole thing, sternal angle is the body of the sternum, and the xiphoid process. Okay? Xiphoid process, body, sternal angle, manubrium, jugular notch, clavicular notch. So, we're going to keep this here, and now we're going to look at two types of ribs. We have the left and the right rib. You're going to be required to know what's left and what's right. Okay? So you have different markings here. First, let's learn all the markings, and then we'll learn how to know what's left and right. This end right here, the smooth cut, that's the sternal end. It goes into that cartilage that connects to the sternum. Okay? This whole thing is the shaft with the angle right there, the angle of the ribs. Below here, you see this little extra space. That's the costal groove. Okay? That's important. That's going to tell you what's left and right. So remember that. Costal groove. Okay? You have that costal tubercle, the superior and inferior articular facets, and right there on the head of the rib, you have the superior and inferior articular facets. On the tubercle, you have the tubercular facet, and again, the angle. So, now, how do you know what's left and right? We have 2 ribs here. We look first, of course, put the sternal end to the front. Always hold the bones like they're on your body, okay? So put the sternal end to the front because your sternum is in the front. That means this is the vertebral end that goes to the back. So now it could either be like this, or we can go and make it like this. Either way, this is in the front, this is in the back. Okay? Now, going back to this costal groove, I told you that was very important. That has to be inferior. That's where all those blood vessels and nerves are hiding. Okay? So that has to be on the bottom. So sternal end is in the front, vertebral end is in the back, the costal groove is on the bottom. For me, this is a left. Okay? It would go like that on you. Okay? And now let's look at another one. Again, this is the busy end, where these facets are. That goes in the back. Sternal end goes in the front. Costal groove is on top. That's supposed to be on the bottom. So we have to bring it over here. Sternal end, vertebral end, costal groove is on the bottom. This is a right rib. Okay? That's how you tell left and right ribs. Alrighty. Now, we're going to do the vertebrae. We're going to start with C1. Okay? C1, also called atlas. Atlas, okay? Now, again, you're going to need to know what's forward and what's back, what's anterior, what's posterior. Okay? Here we have a small arch, and this is a much larger arch, if you can see that. The smaller arch, that's called the anterior arch. Okay? This big one is the posterior arch, or ventral and dorsal. Okay? So that's the anterior tubercle, posterior arch, anterior arch. So now we know this bone is supposed to be either like this or like this. We don't know which one it is yet, but at least we know this is the bigger arch is posterior, smaller arch is anterior. Now, for specifically this bone, these articulating facets look very different from these. These look oval shaped. These look kind of like a bean or like a peanut. These articulating facets, the peanut ones, articulate with the occipital condyles of the skull. So that's how it would go. Okay? Actually, like that. Just like that. Alrighty? So, you have that anterior arch, posterior tubercle, anterior tubercle. Now you know the ones that look like peanuts or like beans, they go up. They're the superior articular facets. And the oval ones are the inferior articular facets. Okay? Every vertebrae is going to have a vertebral foramen. Okay? That's the purpose of them, is to protect the spinal cord. Okay? That's where the spinal cord goes through. Alright. Now, right here, these two processes, transverse processes. Okay? Transverse process 1 and 2. Right here, this whole transverse foramen. Transverse foramen here, transverse process, superior articular facets, inferior articular facets, anterior arch, anterior tubercle, posterior arch, posterior tubercle. That's all it is for C1. Now, C2 is starting to slightly more look like all the other vertebrae, except for this big portion right here, which is the dens. This dens simply is anterior. Okay? If you don't remember that, you can remember that this new spinous process that's being formed has to be posterior. Okay? So, we put this dens anterior, this spinous process posterior. Alright? Now, we have, again, and that's simple because the dens has to be superior. It can't be inferior. Underneath the dens on the other side, we're now forming a body. Okay? Something that all the other vertebrae are going to have, and even the sacrum. So, it's easy. Dens is on top, body's on the bottom, superior articular facets. Right there are the inferior articular facets. On the side you can see the transverse process. Again, the transverse foramen. Right? Now we're forming a spinous process right here. Rather than having those tubercles or arches like on C1, we have the spinous process. Here you have the lamina in between the spinous process and the articular facets. That is the lamina. And that'll be on every single vertebrae alongside with the spinous process. Okay? In between the body and the articulating facets, that's the pedicle. And again, that's going to be on every single vertebrae. Okay? So, and vertebral foramen, as usual. Spinous process, lamina, transverse process, transverse foramen, dens, superior articular facets, body, inferior articular facets. Okay? Now let's look at, this is C1 and C2. So, we know that this is anterior and it has to be superior. Now we know peanuts have to be superior and the smaller arch is anterior. So we can simply put it like that, and that's exactly how these two bones articulate. Okay? Just like that. And then the skull would be right on top. Anterior, posterior. And that's how you can get a larger angle when you turn. Okay? So, we're going to move on to C3 now. C3 is going to be pretty much like every other vertebrae. Okay? There's a couple of differences between them, which we'll go over at the end when we finish all the vertebrae. But as long as you know these, you should be fine with all the other ones. So, now we have a body. Just like in C2, we have a body. Again, spinous process. In between spinous process and superior articular facets, we have a lamina. In between superior articular facets and the body, we have a pedicle right there. Okay? Still transverse process, still transverse foramen, still vertebral foramen. Okay? And that's it. That's all you need to know for C3. Okay? Now, moving on to something a little bit different. Thoracic vertebrae. Okay? Remember, we have 7 cervical, 12 thoracic, 5 lumbar, and then sacral. Now, you can see that there's a big size difference, right? Between the cervical, thoracic, and then let's just bring in lumbar here. There's a huge size difference now, right? So, let's go over the differences between cervical and thoracic right now. Besides the size difference, you can see that there's no more transverse foramen, right? Here we have the transverse foramen. All cervical bones, all cervical vertebrae will have a transverse foramen. No other ones will. Thoracic and lumbar have no transverse foramen. Still have a spinous process, still have a lamina, still have a transverse process, superior articular facet, inferior articular facet, right there. Still have that body, still protecting the spinal cord with, this is where it goes through, vertebral foramen, okay? Still have that pedicle. Everything else is about the same. Here now, we're forming an inferior vertebral notch, okay? That's where a lot of the nerves are going to go through. I'm sorry, that is actually where the ribs are going to articulate, okay? So inferior vertebral notch is right there. So the biggest difference between cervical and thoracic that we know so far, inferior vertebral notch and no transverse foramen for anything but cervicals. Now, one more thing about what cervical has that no other bones have, well, no other vertebrae. They have a bifid right on their spinous process. C2, because C1 has no spinous process, it's excluded. Cervical 2 to cervical 6, so those bones only, have a bifid. Bifid is simply this. Spinous process comes out and separates into two right there. That's the bifid. You can see there's a little separation right there. Okay? That's what it is. C2 to C6. Not C1, not C7. None of the thoracic, none of the lumbar. Okay? That's a major difference between the bones as well. So, when you see a transverse foramen or a bifid, you can say right away, that's a cervical. Alright? So, now, we've done cervical, we've gotten through thoracic, now let's do lumbar. Lumbar are big. They're the 5 last vertebrae. Okay? And once again, it's the same thing as the thoracic, except just larger. It's a big body, larger articular facets, superior and inferior, transverse processes, spinous process, lamina, pedicle, vertebral foramen, and inferior vertebral notch. Now, that's it for the vertebrae, but we still have a question as to how do you know, besides C1 and C2, whether to hold the vertebrae like this or like that. So, for the most part, this spinous process should be pointing slightly down. It's more obvious on the middle thoracics, less so on this one possibly, but you can see how it's still pointing down, right? So the body always has to be in the front, because same as you, your body's in the front and your spine is in the back. Same thing with this bone. Spinous process has to be in the back, body has to be in the front, right? So you can see how it's slightly pointing down. That means this has to be like this, not like this. This is pointing up, okay? When you see people bending over, especially with skinnier people, you can see the points of their spinous process protruding, okay? So that's how you can tell. Now, another difference between thoracic and lumbar. We have them set like this. This is superior, this is inferior, right? Look at the superior articular facets. They're pointing posterior. Now look at the inferior articular facets. They're pointing anterior towards the body. That's anterior. Now let's look at the lumbar. Superior articular facets, they're pointing kind of medial now, right? And inferior articular facets pointing kind of lateral. That's a big marker for you as well. Okay? So that's how you know whether it's thoracic or lumbar. You should be able to identify which one is which in the more extreme cases. You shouldn't be saying that this is cervical or thoracic. You should know all the cervical ones, given that they all have transverse foramen and that most of them have that bifid. That was the vertebrae. Now we're going to get to the last part of the axial, which is the sacrum. Okay? First of all, you have to understand that sacrum is 1, 2, 3, 4, 5 fused vertebrae. Okay? 1, 2, 3, 4, 5. And then here you have the coccyx, which is 1, 2, 3, 4 fused vertebrae. Sacrum, coccyx. Okay. We're going to start with right here, right at the anterior portion. This is anterior, this is the posterior. Okay? Right here, the anterior, right there is the sacral promontory. Okay? This whole thing is the sacral body, promontory. Right here you have the sacral ala, the auricular surface, not articular surface, auricular surface, okay? So that's the auricular surface, the superior articular facets. Right here should be this sacral canal. You can't really see the hole because there is none, but that is the sacral canal. It'll go down to here, which should be the sacral hiatus, okay? That's where all the nerves are coming out from. And these two, that should be the sacral cornua, okay? You can see that better in your lab manual. Right in the middle, you have this medial sacral crest, lateral sacral crest. One is sacral foramen, multiple sacral foramina, okay? Foramen is singular, foramina is plural. So if your professor points to 2, if he puts a sticker here and points to 2, that's sacral foramina, not foramen, okay? So that's that here. Auricular surface, apex would be right here, right in between the sacrum and the coccyx. Base is this whole thing. Promontory, body, the sacral canal, articular facets. In the front we have the ala, auricular surface, not articular, sacral hiatus, sacral cornua, sacral foramina, medial sacral crest, lateral sacral crest, and that's it for the sacrum. Okay? So, now we're going to look at some pictures. Some professors want you to know fontanelles. So, this picture is showing you the superior portion of a baby's skull. You might have heard before that babies have that soft spot that you're not supposed to be touching. That's called a fontanelle. So on the left there, you can see that anterior fontanelle. It's quite large. On the back, you see that occipital fontanelle. If you look at this next picture, now you're starting to see the sphenoidal fontanelle, as well as the mastoid fontanelle. Sphenoid bone is in the front, so it makes sense that sphenoidal fontanelle is in the front. That mastoid process is in the back, on the bottom, so that makes sense as well. Okay? This next picture showing you the sinuses. Okay? Again, as long as you know the bones in the skull, this is pretty easy. The top one, you see on the left picture, the top sinus is the frontal sinus. Again, on the left picture, in the middle, you have two of them. The one in the front is the ethmoid, and the one in the back is the sphenoid. Same thing in the skull. The ethmoid bone is in the front, and the sphenoid bone is in the back. Same thing with the sinuses. Below both of them, you have the maxillary sinus. Same thing as you have the maxillary bone. So those are the 4 sinuses you need to know. Okay? Now, last picture showing you the ribs again. Going back to the ribs, we have 24 ribs, 12 pairs. We have 7 true ribs and 5 false ribs. The first are true ribs because they're directly connected to the sternum. Now, the false ribs, we have 3 that are connected by cartilage, but they're connected not directly, but if you see on the bottom, they're connected by 1 cartilage at the end. Okay? And then you have 2 floating ribs all the way at the bottom. So, ribs 1 to 7 are true ribs. Ribs 8 to 12 are false ribs. The first 3 are false because of the cartilage, and the second 2 are false because they don't even connect to the sternum. They're floating. So those are the 3 ribs. Those are the false and true ribs. So that was the axial portion of the bones. Next we're going to do the appendicular. Stay tuned for that.